Welcome to 101 on Plus TV Africa, where the big stories live. My name is Elsie Godwin. On this episode, we are one-on-one with the Managing Director, CEO of Avon Healthcare Limited. She's a passionate healthcare advocate who has also featured as a contributing resource and choice speaker on issues regarding innovation, business leadership, and healthcare in the country and beyond, with organizations such as the World Health Organization, International Finance Corporation, and the Corporate Council on Africa. A trained lawyer, Adesimbo Ukiri holds an LLB from Obafemi Awolowo University and is a Sloan Fellow of London Business School, where she obtained a master's in management. Thank you for joining us, ma'am.
You're welcome. I'm happy to be here.
Okay, so with over 7 years in the industry, help us understand the Nigerian healthcare system.
Okay, I'm going to have to correct you a bit. It's about 10 years in the industry. But yeah, that's good. It's you know, we all kind of talk about how much progress we still need to make, and we're right. But in trying to help people to understand it, I'll break it into two. So the healthcare system in Nigeria, you have first the delivery side, and that's where you have the hospitals, you have clinics, you have also the diagnostic centers, you have pharmaceutical companies as well. Not just those that manufacture it, but those that import it and make it available for people to buy on a retail basis. And then on the access side, you have people like us, the health insurance, health management organizations, who are helping to give people the financial ability to access this healthcare. Okay. On this side as well, on the demand side, you also have some NGOs working very prominently to improve health education and awareness and preventive initiatives, and just to let people know what services are available and what kind of services they need to access in order to take care of their conditions. Okay. So in a nutshell, that's the entire sort of healthcare value chain. You have also finance institutions who provide loans and facilities to hospitals and clinics and diagnosis centers to purchase equipment. You know, so when all of this work well together, and when of course you have the populace who have the means to pay for these healthcare services, then you have a system that really works.
So how many percentage of this populace can actually pay for the services?
That's a good question. I think according to the last statistics that we have about 70% or more Nigerians living at or beyond or below the poverty line. So that's a really, you know, it's a sad story. Many Nigerians can't afford to even feed themselves, talk less of paying for healthcare services. But the good news is that we're spending so much on healthcare services now that all we need to do is devise ways of spending them in a smarter fashion, so each naira can go a longer way. One of the most inefficient ways to pay for healthcare services is to pay for it out of pocket. Meaning every time you fall ill or you need healthcare services, you go to a hospital, then you dip your hand in your pocket and you pay. That's very, very inefficient, which is why the whole talk about universal health coverage has come to be, you know. And what we advocate is for you to subscribe to a health plan, so that when the need arises, you don't pay out of pocket when you need to access healthcare services. Okay,
now we're talking about healthcare services. What is the relationship between HMOs and NHIS?
Aha. NHIS, the National Health Insurance Scheme, is the regulator of the industry. So that is the body that operates as a regulator over the HMOs in the country. That's a bit odd because on one hand it's supposed to regulate the activities of the operators, including ourselves, Avon HMO, but on the other hand it also operates a health insurance scheme itself. All federal civil servants are registered under the National Health Insurance Scheme, and NHIS, our regulator, is also the operator of that scheme. To some extent it works through HMOs as well, who help to ensure that enrollees, that's people who are registered under the scheme, are able to receive care at the hospitals they're registered with. But it's very much a funny issue right now, because as you can imagine, operators would like a regulator to actually regulate, okay, and leave the operations to the, you know, to the players in the industry, and just look for ways of enabling and putting a framework in place that encourages and enables the whole sector to grow, and for more Nigerians to be able to avail themselves of the opportunity that it presents. So it's a kind of a thorny issue right now.
Okay, if you say thorny issue, then if I get you right, you are not comfortable with the fact that they regulate and operate at the same time. Do you think this affects the way they run the business?
Oh yeah, I mean, I think they would be much more effective if they were not an operator at all, if they were just a regulator, because in the first instance, you know, an operator cannot regulate itself, and that's primarily what the NHIS is doing right now with regards to the scheme that covers the federal civil servants. Because, I mean, then who does the consumer have recourse to at the end of the day? The person who is supposed to regulate the kind of, the quality of services you are obtaining is also the person who is delivering that service to you. And also because of it's just, you know, operationally, you know, challenging and difficult, and they had not been built to be operational, even though they've tried over the years to extend presence in all the states of the Federation. They've tried to be operational, but, you know, the kind of resources and the kind of skills it takes to be efficient at being operational is quite different from the kind of resources and skills that you need to be effective in the area of regulation. And I think trying to balance both is kind of shortchanging all Nigerians.
So what are some of the issues rocking the system as it is right now?
Okay, when you say the system, I'm going to try and take it from a really broad view. You know, there's distrust of the system right now. I mean, there's been very public face-offs, if I want to use that word, between operators and the regulator last year. So there have been talks about HMOs not paying hospitals. There's been talks about hospitals also not delivering services for which they've been paid. There's also talk of the regulator trying to replace operators and trying to, you know, get into contact with private organizations across the country and trying to get them. Which is the case with the NHIS. Exactly. You know, so it's all of that has created some kind of distrust from the general public to the entire system, and it's not in anybody's best interest for that to keep happening. So one of the main issues we're looking to be able to lay to rest this year is to have the kind of effective regulation that identifies people within the system. When I say people, I mean organizations within the system who are not playing by the rules, and, you know, impose the necessary penalties, suspend them if need be, fine them if need be, but make it public and give confidence back to the Nigerian people that, you know, we are looking after what is going on in here and we are protecting your interest. So this is something that is an issue that we would like to see addressed this year. Another issue is just the lack of awareness.
Sorry, before you go to lack of awareness, you mentioned distrust, and then you mentioned confidence. So what can be done to really restore this confidence? Because it's clear, I mean, you've talked about distrust over and over again. What can be done, aside the penalties and then putting them out there for people to know that these people are working and people are getting punished? What exactly can be done to restore confidence?
You know, I say it all the time. I'm glad to have the opportunity to say again, transparency is crucial. In many other parts of the world, the financial statements of health insurance companies, HMOs, are published because it is a relationship that is built on trust. A person subscribes to a health plan from a particular HMO, believing that that HMO is able to fulfill its financial obligations as and at when they become due. How is one supposed to be able to take that decision when you don't see their financial statements? You know, audited financial statements are submitted to the NHIS on a yearly basis. This should be published. You know, there should be the same way, you know, you have the stock exchange publishing quarterly returns or quarterly results of all the companies that are quoted. We should have a regulator that also publishes numbers that HMOs are posting on a quarterly basis. So let the public know who is paying claims, who is not paying claims, who has a huge, you know, portfolio of members that are dissatisfied with the kind of services they're receiving. There are so many indicators of financial strength and financial performance that if we were to have them published, then confidence would be higher because people would know for sure who is struggling, who is not, and who, you know, they want to put their trust in. That's something that I think we can do pretty quickly. Okay,
so even if this is published, you mentioned lack of awareness. I think we should pick it up from there. So how do we get people aware about the published financials, about the penalties, and about the importance of insurance itself?
Yeah, I mean, what we're trying to do right now is to let Nigerians know that, you know, health care, paying attention to your health is actually a lifestyle choice. You know, most people tend to think of health and everything around it as a social service that the government has to provide, and the government has to look after me, and the government has to, or people that are also maybe employed in the private sector think, oh, my company has to provide for me, my company has to look after my health. No, each person has to be responsible for their own health. And, you know, we've realized that, most Nigerians have this aversion to insurance generally. And part of what we're doing is also letting people know that health insurance is quite different. We should actually be calling it health management, because when we work with anybody, what we do is we help you to manage your health.
Okay.
So it includes preventive as well as curative, services. So just getting people to think differently about healthcare and getting them to own their own, well-being is a great step in raising the awareness around health insurance, and also the benefits of having it. Nobody prays to be ill, nobody prays to have a condition. But when these things occur, oftentimes you might not have enough money to pay the bills. And even if you have the money, sometimes people just think about how much they would pay the hospitals, and they choose to go meet their pastor and tell the pastor to pray for them, or they go to a chemist down the road and then, self-prescribe something, or talk to a doctor friend or a nurse friend on the phone. And all those would not happen if you were sure that if you walked into a hospital, you're going to get treated because you've already subscribed to a health insurance plan.
Okay, so the coverage for health insurance in Nigeria is still very low. I mean, we are looking at between 3% to 5%. The figure is a bit dicey right now. But in this awareness, what exactly are we doing, or what platform should be used? Because we know that this number needs to be increased. In a population of close to 200 million, if we have just about 7.3 or thereabouts, that is extremely poor. So what platforms are we using? What is a platform like yours doing to educate people on the importance of insurance?
Yeah, we've gone about it in a non-traditional manner. So part of it is being invited here today. I'm very grateful to have that opportunity to talk to people about health insurance and why it's important. But beyond that as well, we believe this is a message we have to take to Nigerians where we see them. So we are very active across all social media platforms. And you can't go talking to people every day about your health, your health, your health. So we try to mix up our messages. We talk about them about entertainment, and then we put in healthcare and how they need to take care of themselves. We talk about sports. We talk about a lot of things that we know the average Nigerian tends to be interested in, and then we slip in there a message about their health and about the need to subscribe to a health insurance plan. We're also on radio. On radio is not about advertising. It's also about engaging with the listeners in giving them tips about how to remain healthy and what to do in order to live a healthier, fuller life. And the response to that has been quite good. We believe, however, that there needs to be an industry-wide effort in pushing this awareness. What each individual company does on its own will not be enough to push this awareness. And when I say industry-wide, I just don't mean the HMOs. I mean all the companies along the healthcare value chain, because it's in our best interests for Nigerians to stop paying out of pocket and subscribe to health plans. That way, even hospitals and clinics will begin to have a much more predictable and reliable stream of income, based on which they can access financing, based on which they can improve their facilities, equipment, pay their staff more regularly and better salaries, etc., etc., etc. So I think we should come together as one sector and push for this very, very strongly this year.
Okay, so earlier on you mentioned transparency, and I was going to ask you how transparent the industry is, but you already mentioned a bit on it. I also love you to touch more on it, and also the reforms. I know in whatever sector it is we're talking about, even if you want things to move forward, it still boils down to the policies.
Exactly.
Who is in charge of these policies? How often is it being reformed? So what is the case of reformation of policy in NHIS and the health management organizations system right now?
You've touched on something that actually is also, crucial for us all. The act under which we operate as HMOs, and which brought the NHIS into being, it was established in 1999. It's a shame it's never been reviewed since then. So we're working within the regulatory framework that was established, so many years ago. Our counterparts in the pension sector, however, they've had the national, I think it's called the Nigerian Pensions Reform Act. They've had their own regulation. They've had it reviewed first in 2004, 2008, 2014 as well. So it's such a shame that nothing has been done. I mean, the world has moved on since then. Nigeria has evolved since then, and we definitely have also learned a lot from the years of operation that we've had. And I would really like to see this reflected this year, if possible. Under the last administration, actually, there was a reform bill that made it up to the final stage, and what remained to be done was for the president to assent to it, and that didn't happen until the administration ended. So this is something that's really, really crucial. And the funniest thing is that, you know, when we have all the amendments that have been suggested to the bill, and when we have a new regulation in place, it will affect every Nigerian, both the rich, the poor, because health insurance is supposed to be a kind of welfare system where the people who are rich are helping to pay for the health care of the people who are poorer, and where the people who are healthier today are paying for the, you know, health care of people who are ill today, because we all don't fall ill at the same time, and we don't have the same level of financial ability. So this is something that is really, really crucial to our development as a nation.
Okay, right. I want us to move into the non-remittance issue. But before we get there, which I know you say is another crucial point, let's talk about the responsibility that NHIS have. Now, we know that they play as regulators and then they play as operators. That's probably where we are right now. It's probably not going to change in the next 5 years or thereabouts. What do you think they can do differently to play better in while representing the both sector? That's still playing as a regulator and an operator. What do you think they can do to work better at least?
I'm afraid I'm going to be a lot more optimistic than you, and I hope that it will get that the acts we work with now will get reviewed within the next 2 to 3 years. I hope the whole industry stands up and demands for that to happen, and I hope that the administration listens and does something about it. So,
okay, so pending then.
Pending then, however, I think it's a question of leadership. You know, we need somebody at the helm of affairs at NHIS who is going to push the whole industry forward. You know, the two can run concurrently, and they can run concurrently in a way that helps to benefit the Nigerian on the street. And what helps to benefit Nigerian on the street is to ensure that the HMOs that are in operation are strong, that they are also sufficiently monitored to make sure that they are fulfilling all the responsibilities and obligations they have under the Act, to also ensure that hospitals are being monitored and that they are also living up to their own responsibilities. And, you know, it takes a different kind of infrastructure to do that than it takes to be an operator who is looking for how do I get more people onto my scheme. Maybe there is a need for the NHIS to split itself into two and have two large divisions, and have a division that's responsible for, you know, the regulatory aspects of what they do, and have another division that's responsible for the operational aspect of what they do. But pending the time when we get the kind of reforms that we're hoping to get, I mean, this is something that I think they would pay a little bit more attention to.
Okay, let's talk about non-remittance. I mean, this is the part that Nigerians that are already on this scheme complain about. You hear them saying, oh, the hospitals are not rendering service and I am on a scheme, right? And then you hear a case of the HMOs not paying the hospital, and they tell you this is why we are not doing our job. So what is happening in that space, and why do we find ourselves in such situations?
Yeah, I think this has reduced drastically over the past 4 years.
Okay.
NHIS, for instance, stopped paying HMOs in advance for what we call capitation, which is a payment that is made through HMOs to hospitals for the people who are registered at each of those hospitals. So right now, prior to that, I used to be paid first 6 months in advance, then 3 months in advance. Now NHIS just pays it to HMOs on a monthly basis. That is in respect of the Federal Civil Servant Scheme, which the NHIS operates in itself. As for the private health insurance scheme, which the HMOs operate on their own, I do not think you will find such a huge problem with non-payment of medical bills. Sometimes also, you know, there's always a balance to be struck, because health maintenance organizations such as ourselves are sort of like policemen to hospitals. You know, I like to joke and say that it's almost as if we're at cross purposes, because an enrollee, what we call an enrolled member of a scheme, walks into a hospital. Our own desire is we want him to receive quality healthcare services. We want him to receive it very quickly, the highest quality of care that is available. And we want all that done at the lowest possible cost. But hospitals, on the other hand, yeah, oftentimes we want to give him quality, but they want to do it at the highest possible cost, because that's a commercial entity. They want to make a profit So there's always going to be some tension there. Okay. And sometimes you find hospitals pushing back and saying, no, I want to be paid more. And HMO will say, you know, justify why you need to be paid more. Because for every time an HMO pays more, what it means is that it then has to go and increase the premium to the end user, and the end user also doesn't want to pay more. So we have to keep the entire, you know, scheme balanced on those sides. So
I feel that if we're going to increase the number of people registered under the HMOs, either under NHIS or even the private organizations, then we probably need to have like a kind of awareness that will catch them young, make them understand. And the younger population in this part of the country right now are people that are more or less into they're self-employed, or they are doing something that helps them probably partner with different corporate organizations, and they're really not the staff of that organization. You know, they are independents of some sort, creatives of some sort. For me, it took me last year for me to understand that I can be on a HMO plan without being under a corporate organization. So I know your platform have such plans. How are you working with other platforms to make them understand that this is important and this is available? Because catching them young, I think, is key. So how are you pushing out this awareness and making them understand that you don't have to be in a 9-to-5 to be under an insurance, a health insurance plan? Okay. I mean,
yeah. I mean, you make a very good point. I mean, for a very long time in this industry in Nigeria, those health plans were only available to large corporate organizations who took them out on behalf of their staff and their families. And but since we came onto the scene, we've been very particular about wanting to empower all Nigerians, whether they work with large organizations or not. And it goes well with, you know, what we say when what we mean when we say that each person is accountable for their own health and they need to take it seriously. We agree with you as well that, you know, the need to catch them young is very, very crucial. Older people more or less have their behavior all set. You know, the people who are in their 40s and their 50s, I mean, the psychology of how they interact with health and how they interact with insurance as a concept is already more or less set in stone. So we're very particular and very passionate about ensuring that the next generation of Nigerians understand this from very early on. Okay. So we do have events where we collaborate with what we call associations or gatherings of SMEs, which is what the average Nigerian school leaver, you know, that's what they're gaming, what they are trying to be. Most people leave university these days, and it's no longer about looking for an oil company or a bank to work with. It's what can I do for myself? So wherever we find Nigerians like this gathered together, we normally will go there and give a talk and, you know, work with them to explain to them why they need to cover their health from the get-go. I mean, for them it's even more important because they are the sole sometimes breadwinner for their businesses. So anything that affects their health generally tends to also have a very adverse effect on their income stream and on the business that they're doing. So we work with them like that, and also because we know that they tend to do a lot of their own advertisement, a lot of their own engagement online. So we're very, very visible online in trying to engage with this population.
So finally, before I let you go, is this a good time for investors?
I believe that it is, because right now, you know, the time to come into a market is when it is rather low, because then you can gain from it picking up. The opportunities in the healthcare sector in Nigeria is immense. We have, like you said, a huge population, and we've barely scratched the surface of that. And we now have experienced people as well who've been working in the sector, understand the market, understand the dynamics of how the various players in the markets interrelate. And technology hasn't yet permeated all aspects of it, so you can imagine what will happen by the time technology also permeates the healthcare space. Right. So, I mean, this is definitely a good time to invest.
Thank you so much for being part of One-on-One today on Plus TV Africa. Thank you.
Thank you.
Okay, thank you once again for joining us on this episode of One-on-One. We've been chatting with Adesimbo Ukiri, a health insurance expert and managing director, CEO, Avon HMO. To catch up on these conversations and more interesting discussions, do subscribe to our YouTube channel at Plus TV Africa, and don't forget to follow us on our social media platforms, Twitter, Facebook, and Instagram, still at Plus TV Africa. Also visit our website at plustvafrica.com for more information and round-the-clock quality content broadcasting. My name is Elsie Godwin. See you soon.